Good afternoon, colleagues. I would just remind members that social distancing is in place throughout the building and in the chamber. Members just to observe these rules at all times. The first item of business today is First Minister's questions. Before we move to questions, the First Minister is going to give us an update on the three-weekly review of lockdown restrictions, which is a slightly longer statement than normal. First Minister.
Officer, the Scottish Government is required by law to review lockdown restrictions every 3 weeks. The latest review falls due today, and I'll shortly report on the decisions we've reached. First, though, I will report on today's statistics and other developments. Since yesterday, an additional 77 cases of COVID have been confirmed. That represents 1% of those newly tested yesterday and takes the total number now to 19,534. This is the highest number of new cases in almost 3 months, which underlines the need for continued caution. A total of 249 patients are currently in hospital with confirmed COVID, which is an increase of 1 since yesterday, and 2 people are in intensive care, which is the same as yesterday. In the past 24 hours, no deaths have been registered of patients who had been confirmed through a test as having the virus. The total number of deaths under that measurement, therefore, remains 2,492. However, yesterday's figures from National Records of Scotland, which reported 3 COVID deaths during the previous week, showed that the total number of deaths is higher than that, and of course it showed that people are still dying from this virus. We must never lose sight of the grief and heartbreak caused by every one of those deaths, and I want again to send my condolences to everyone who has lost a loved one to this illness. Let me turn now to the review of lockdown restrictions. I am not able to indicate today a move from phase 3 of our route map out of lockdown to phase 4. We will remain for now in phase 3, and I must give notice today that this may well be the case beyond the next review point too. For us to move to phase 4, we would have to be satisfied, and I'm quoting from our route map, that the virus is no longer considered a significant threat to public health. As today's figures have demonstrated, and as has been confirmed to me in advice from the Chief Medical Officer, this is definitely not the case. Today's update, therefore, sets out which phase 3 restrictions will be changed in the coming weeks, while other necessary restrictions remain in place. This has, of course, involved some difficult and delicate decisions. The figures we have been reporting in recent weeks show that incidence and prevalence of the virus continue to be at low levels in Scotland as a whole. However, the range for our R number has recently increased, and our most recent estimate suggests that it could currently be above 1. Of course, this is partly because when prevalence is generally low, localised outbreaks have a bigger effect on the R number. That said, though, we must continue to monitor it closely. We are also recording more positive cases than 3 weeks ago. When we last reviewed the lockdown measures, we had recorded 14 new cases a day on average over the previous week. We are now recording 52 new cases a day on average. And in the past 3 weeks, we have seen one significant outbreak of the virus in Aberdeen and a number of smaller clusters in locations across the country. We are also now dealing with a significant cluster in Cooper Angus linked to a Two Sisters food processing plant. And that is no doubt reflected in the fact that 27 of today's 77 cases are in the Tayside Health Board area. In total, 43 cases have been so far identified as part of that outbreak. That is 37 people who work in the plant and 6 contacts of theirs. This number will almost certainly grow. We are stressing the importance of all workers at the plant self-isolating and getting tested. A mobile testing unit remains on site, and the factory has been closed down for a 2-week period. Given the nature and potential scale of this outbreak, we are considering carefully and urgently whether further restrictions are necessary. I will chair a further meeting of the Scottish Government's Resilience Committee later this afternoon. In addition, there are several cases linked to schools which are worth noting. A total of 8 adults at Kings Park School in Dundee have tested positive, which has prompted the decision to temporarily close that school. In addition, the number of cases in the cluster in North East Glasgow now stands at 16. There's also a separate but linked cluster of 9 cases in Coatbridge. A number of the cases in these clusters are school children, although there is no evidence that they contacted the virus in school. Greater Glasgow and Clyde Health Board are also carrying out contact tracing around several other schools in Glasgow. Finally, on clusters, there were 12 new cases in Grampian yesterday. On the latest figures available, a total of 407 cases have been identified in the Grampian Health Board area since the 26th of July. 237 of these are associated with the cluster linked to Aberdeen pubs, and 1,185 contacts have now been identified from those 237 cases. As I said yesterday, there is evidence now that the original cluster of cases linked to pubs is coming under control, but in recent days we've continued to see new cases which do not seem to be linked to that first cluster. Because of that, restrictions in Aberdeen have been extended, but they will be reviewed again on Sunday with a view to setting out, if possible, a firm timetable for lifting the restrictions. All of these outbreaks have been tackled by our test and protect teams, and current evidence on their performance suggests that the vast majority of contacts are being identified, and most of them are being identified quickly. However, the clusters and new cases highlight a continued need for caution, especially since our priority continues to be to keep schools safely open. Of course, these clusters are not completely unexpected. We have always known that reopening more services and premises, especially indoor bars, restaurants and cafes, might lead to an increase in cases. And indeed, two major risk factors have stood out in reports of recent clusters. As we expected, indoor hospitality, bars and restaurants is one. The other is social events and gatherings in people's homes. We've already tightened some of the rules in relation to the indoor hospitality sector, for example, by putting guidance on a statutory footing and making it compulsory now to collect customers' contact data. I'll announce further measures intended to aid compliance at the end of this statement. Understanding the risks of these indoor settings has also made us think carefully about further changes and the need to ensure rigorous compliance with guidelines. On balance, taking account of the different harms that COVID and the restrictions imposed to tackle it are inflicting on the country, we have decided that the reopenings pencilled in for the 24th of August can proceed. I must stress, though, that such reopening should only happen when the appropriate guidance covering that activity or setting has been implemented. We will also monitor the impact carefully, and as with everything else, we will not hesitate to reimpose restrictions should that prove necessary. Full details will be available on the Scottish Government website, but the 24th of August changes include some outdoor live events with physical distancing, enhanced hygiene and restricted numbers. Organised outdoor contact sports will also resume for people of all ages, but for outdoor coaching sessions there will be a cap of 30 on the total number of people who can be coached at any one time. Driving lessons will resume, and indoor face-to-face advice services, for example Citizens Advice, can also open to provide financial advice when necessary. We've given particularly careful consideration to premises like bingo halls because these share some obvious similarities with the indoor hospitality sector. It is therefore of the utmost importance that guidance is strictly adhered to, and we will be monitoring that carefully. Let me now turn to the reopening of gyms, swimming pools and indoor sports courts. 3 weeks ago I indicated they could reopen from 14th September, but I also said then that we would consider if that date could safely be brought forward, especially given the wider physical and mental health benefits of access to these facilities. Having done so, I am now able to confirm that these facilities can reopen, subject to guidance being in place from the 31st of August. For indoor sports courts, which includes dance studios and gymnastics, it is worth stressing that for people aged 12 and over, the reopening on this date applies to non-contact activity only. These are the only key changes to restrictions that we plan to make within this review period. However, we hope that further changes will be possible from Monday, 14 September, in line with what is currently set out in the route map. However, I must stress these possible changes are at this stage indicative only, and given the volatility we face in transmission of the virus, there is a very real possibility that some or all of these plans could change. However, with that significant caveat, we hope that from 14 September, sports stadia will be able to reopen, though only for limited numbers of spectators and with strict physical distancing in place. Some professional sports events might be arranged for spectators before then, with Scottish Government agreement to test the safety of any new arrangements. We also hope that from 14 September, indoor contact sports activities can resume for people aged 12 and over, and we hope that entertainment sites and cultural venues such as theatres and live music venues will be able to reopen from that date too, but with strict physical distancing in place. To facilitate that, these venues can reopen for preparation and rehearsal from the 24th of August. Finally, we hope that from 14 September, wedding and civil partnership receptions and funeral wakes will be able to take place with more attendees than at present, although numbers will remain restricted. We intend to set out more detail in this, including on permitted numbers, shortly. These are the activities and premises for which we are currently setting indicative dates, but I want to stress again that these are indicative dates at this stage. We are unfortunately not yet setting a date for the reopening of non-essential call centres and offices. We will review this again at the next review point. For now, working from home will remain the default position. I know that many office workers miss seeing their colleagues and many are keen to resume a more normal daily routine. I also know that some businesses, however well they may be managing to work virtually, will want more of their employees to meet and work together. And I am acutely aware of the impact of home working on services like cafes and restaurants, which are based in areas with lots of office workers. However, a full return to office working, given the numbers involved, would significantly increase the risk of indoor transmission. It would also make buses and trains significantly busier and increase transmission risks there too. Our conclusion, therefore, is that a return to working in offices, unless that work is essential and cannot be completed at home, presents too great a risk at this time. The impact it could have on community transmission would also make it more difficult to keep schools open. And so this does, unfortunately, come down to difficult judgments about priorities. We have made clear that our priority is to enable children to be safely back at school. And with the virus at its current levels, that means we cannot do everything else we would like to do, like bring back non-essential offices. Now, I know people will ask why their kids can go to school, but they can't go to the office, and that might seem like an inconsistency. But that logic is back to front. It is because you cannot go to the office and because of the other restrictions we are keeping in place that we are able to send children back to school. If we opened everything up right now, the overall impact would simply be too great. The virus would run away from us and we would in all likelihood be forced to reintroduce restrictions none of us want to see. We have only been able to relax some restrictions because others have remained in place. There is one final issue I want to cover today. It relates to the risks I mentioned earlier of transmission inside people's homes and the risk of transmission in pubs, cafes and restaurants. We have considered very carefully what further enforcement actions we can take to minimise the risk of transmission in those settings. For the indoor hospitality sector, I am grateful to the many pubs, restaurants and cafes who have opened responsibly and who have gone to great lengths to stick to the rules and guidance on ventilation, hygiene, face coverings, contact details and physical distancing. Their efforts are hugely appreciated. However, we also know that not all hospitality businesses have implemented the guidance effectively. We therefore intend to strengthen the power of local authorities to act in these circumstances. The Scottish Government has powers under emergency legislation to issue directions in respect of a class of premises, for example, directions to close all pubs in a particular postcode. We intend to give local authorities the power to act in respect of individual specific premises that are breaching guidelines and risking transmission of the virus. This power would enable local authorities either to close such premises or to impose conditions on them remaining open, where they deem that is necessary for the purpose of preventing, protecting against or controlling the spread of infection. We believe this is an important, indeed a vital, but also a proportionate step which will help local authorities ensure businesses stick to the guidelines and that action can be taken where these guidelines are being breached. The second area we have been looking at carefully is indoor social events like house parties. We know from reports of our own test and protect teams, and we also know from evidence from other places in the UK and indeed around the world, that these indoor events pose a very significant transmission risk. And because the virus is so infectious, if it is present at an event like this, there is a very high likelihood that most people at the event get the virus. That is why we advise strict limits on indoor gatherings. Right now, our advice is that no more than 8 people from a maximum of 3 different households should be gathering indoors. The vast majority of people I know will be sticking to this, and it is not easy to do so, so I'm very grateful to them for that. But we also know that a minority don't, and we know that large house parties pose a very real and significant risk of causing clusters and outbreaks, such as some of those we've been dealing with in recent days. So for use in cases of flagrant breach and as a last resort, we intend to give the police powers of enforcement to break up and disperse large indoor gatherings. We believe that both of these new powers are necessary if we are to continue to suppress this virus minimise the risks of outbreaks and keep it under control, which is so necessary. We will lay the regulations for both of these measures next week, and we intend that they will come into force from next Friday, the 28th of August. Presiding Officer, the last 3 weeks have given us mixed news. We have seen a rise in new cases in a number of clusters across the country. We have also regrettably had to reimpose some restrictions in the city of Aberdeen. But we still have low numbers of new cases overall. We have very low numbers of hospital admissions, and we have strong and growing evidence that our test and protect teams and that system overall is working well. Given the resurgence of COVID that we are seeing in some parts of Europe, and given that we always knew that reopening more parts of the economy would be risky, the picture in Scotland could of course be better, but it could also be significantly worse. We are still making progress in our overall fight against this virus. But we cannot take this progress for granted, especially if we are to keep our schools open, keep businesses and services open, and retain our ability to socialise and meet up in small groups of friends and family. The fact is, COVID is still a major risk, and we must still be very cautious. We can see the evidence of that in Aberdeen, we see it in each new cluster across the country, and of course we see it in reports from elsewhere in the UK, Europe and around the world. And that is why today's review has sought to take a careful and a balanced approach. I hope that the reopening of some services will be welcomed, and notwithstanding the risk that each and every reopening presents, we know it is essential to reduce the economic harm that the virus is doing. But I hope that people will also understand why, as we try to open services and keep them open, we must take firm action when rules and guidance are not being complied with. I also hope that everyone watching will understand that although government must and will take the lead, we make difficult decisions, we draft guidance, we propose laws, but we cannot control COVID on our own. We are all dependent on the choices made by each and every single person in the country. So please think carefully about whether you are playing your part as fully as you could and should be. Please do not meet indoors in groups of more than 8 people from any more than 3 households, and that applies in a pub, cafe or restaurant just as it does in someone's home. Remember physical distancing and don't go into crowded places where physical distancing may not be possible. And ask yourself whether your social life feels normal, because it shouldn't at the moment feel entirely normal. Wherever you are, assume the virus is present and act at all times to avoid creating bridges that allow it to cross from one household to another. I've spoken before about the importance of solidarity in how we deal with this pandemic, and I know it is hard, especially after 5 months, but sticking to these rules is an expression of our care for each other. It is the way in which we protect not just ourselves, but our loved ones and our communities. So for that reason, I will end by reminding everyone again of facts, the 5 golden rules that will help us stay safe, even as life gets back to something that is closer to normality. F is face coverings that should be worn in enclosed spaces, public transport, shops, anywhere else that physical distancing is more difficult. A, avoid crowded areas, outdoors as well as indoors. C, clean your hands regularly and thoroughly, clean hard surfaces after touching them. T, 2-metre distancing remains the clear advice. And S, self-isolate and book a test immediately if you have symptoms, a new cough, a fever or a loss of or change in your sense of taste or smell. You can book a test at nhsinform.scot or by phoning 0800 028 2816. Anytime any one of us drops our guard and forgets these rules, we give this virus a chance to spread. We risk turning an infection into a cluster and a cluster into an outbreak. But if all of us stick to the facts, we can continue to suppress it, we can keep schools and services open, and we can think about easing more restrictions in the future. So my thanks once again to everyone across the country who is helping us do exactly that.
Thank you very much, First Minister. We're going to turn now to questions. Could I urge members, we're going to take all the supplementary questions after question 7. All supplementary questions after question 7, but press your button now if you wish to ask a supplementary. Ruth Davison.
Thank you, Presiding Officer. I'd like to thank the First Minister for advance sight of her statement, but today I'd like to turn to care homes and to ask the First Minister, did anyone in the Scottish Government know prior to Sunday's press reports that hospital patients who had previously tested positive for COVID had subsequently been transferred into a care home? And if they knew, when they knew and why it was not made public?
First Minister.
This is a really serious issue, so I welcome the opportunity to address it. Scottish Government ministers do not know the individual clinical decisions that are taken in cases of patients being discharged from care homes, whether they are being discharged to their own homes or from a hospital to their own home or to a care home or to any other setting. The responsibility of ministers is to put in place guidance. There has been guidance in place from the 13th of March. The 13th of March guidance specifically refers to the need for clinical screening of patients being discharged from hospital to take place. That guidance, of course, has developed as our knowledge and understanding of the virus has developed. Of course, we want to understand more about this. The Health Secretary, as she announced earlier this week, has commissioned Public Health Scotland to work with health boards to produce validated statistics and analysis on the number of patients tested prior to discharge and the outcome and the date of that test. That will include examining how many were assessed as being discharged when they were considered to be infectious and the rationales that were in place for such a discharge, for example, in the case of palliative care concerns. And Public Health Scotland are working towards providing this data by the end of September.
Ruth Davidson.
I listened very carefully to every word of that answer, and at no point did the First Minister actually confirm or deny that anyone in her government knew or when they knew. In fact, in April, the First Minister was asked at her daily briefing if allowing COVID-positive patients to be placed in care homes, and I quote, looks reckless, and she said, no, it doesn't. In May, the Health Secretary was asked in this chamber if COVID-positive patients had been transferred into care homes, and she didn't know. In June, the First Minister was asked about this at First Minister's Questions, and she said that it shouldn't happen. If ministers are being questioned, it shouldn't take a Sunday newspaper to confirm this information for the public. One care home that we spoke to says it took a patient in good faith, and only after they'd been welcomed into the home were they then told that this person was positive. First Minister, how do care homes stand a chance in that sort of situation?
First Minister.
With the greatest of respect to Ms Davis, I'm not sure she listened carefully enough to the answer I gave. I said very clearly, and I think this is something that most reasonable people would understand, ministers are not involved in the clinical decision-making about residents being admitted to care homes. Ministers, advised as appropriate by clinicians, put in place the guidance that govern the decision-making process, and that guidance from the 13th of March was clear that clinical risk assessment had to happen. That guidance, of course, has since developed. As I've said a number of times, in the fullness of time, it is right and proper. There will be inquiries into every aspect of our handling of this situation, and that, of course, will include care homes. And the position around care homes, while the responsibility here lies with the Scottish Government, all governments across the UK were taking similar decisions as we tried to manage a pandemic that, of course, was posing a significant risk of infection in our hospitals, including to elderly patients in our hospitals who had no medical need to be in those hospitals. The work that we've now commissioned Public Health Scotland to do in a short space of time will give more information on whether people, the numbers and the circumstances in which patients were tested before being discharged to care homes, and the rationale for the decisions that were taken. We will provide as much information as we can as all of us seek to learn the lessons and reflect on the decisions that are made in the handling of what, as everybody knows, is an unprecedented situation.
Ruth Davidson.
Presiding Officer, I understand completely Minister's role in the issuance of guidance, but if no one in her government knew, she should just be able to say so. Now, in May, Jackson Carlaw raised the case in here of Sandra O'Neill, whose mother died from COVID in the Almond Court Care Home in Drumchapel. As she told us then, she fears her mother caught the disease from another resident who'd been discharged from hospital despite being clearly unwell. The fundamental questions that Sandra wants answered is how this disease got into her mother's home. And yesterday, she spent 4 hours with the police, who interviewed her as part of their investigation into what happened in her care homes. And it's not her mother's carers that she wants investigated. She thinks they did a brilliant job. It's the system that let her and her mother down. But she was told that the question of how the disease got into the home is not part of the police remit. Why not? And where then can Sandra and families like hers go to get the answers that they need?
First Minister.
Sorry, I'm genuinely not sure if Ruth Davidson has stood up here and suggested that it is for me to tell the police what they investigate and how they investigate. That is entirely a matter for the police, and in these matters for the independent Crown Office. It would be completely inappropriate and unacceptable if I was the one making those decisions. I welcome, every single day since the start of this pandemic, I and my ministers have taken very difficult decisions. Some, I hope most of which we have got right, some of which we will have not got right. And I welcome, for a whole range of different reasons, the fullest possible scrutiny of those decisions for the purposes of accountability, but also for the purposes of making sure we learn lessons for the future, both in terms of later stages of this pandemic and for any future pandemics that I hope we don't, but may face in years to come. So I am absolutely open to that. What I will always say, because it happens to be absolutely the case, is that at every stage we have taken difficult decisions with the best of intentions, based on the best evidence and the best knowledge and the best advice that we have had. We're dealing with a novel coronavirus. It is a virus that we have come to understand more, both in terms of the efficacy of testing and the issue of asymptomatic transmission. We have developed our approaches and our guidance as we have gone through that, and we will continue to do that because these continue to be difficult decisions and we will continue to take them to the best of our ability as we navigate our way through the remainder of this pandemic for however long that takes. And we will ensure that as we go, and at an appropriate time, more systematically, there is a full look back to learn whatever lessons require to be learned.
Ruth Davidson.
But there is an inconsistency in the Scottish Government's position on that, because on the one hand it is happy for the Crown Office and Police to push ahead with an investigation into some aspects of care homes, but on the other hand it says we should wait for an inquiry into its own actions. And I think both should happen now, because it is precisely because we don't know how far we are into this pandemic and we don't know when or if it will end. But we need to know, in order to better fight it in future, what mistakes have been made and how to stop them happening again. So on behalf of residents and families who are still seeking answers, will she commit to publishing the remit of the inquiry she's promised and to getting it started?
First Minister.
I know Ruth Davidson is planning to leave democratic politics, but she has been in this Parliament for surely long enough to understand the separation of powers. It is not for me to tell the Crown Office or the police what to do. It is actually completely inappropriate for me to seek to tell the Crown Office and the police what to do. What this government has done, we have, the Health Secretary announced it in this chamber earlier this week, we've asked Public Health Scotland to produce the statistics and analysis on patients tested prior to discharge, the outcome, the dates and the rationale for the decisions that were taken. That work will be published. It is the aim is to have that by the end of September, in a matter of weeks' time. And we will, as soon as we consider that the time is right, set out for discussion and consultation across Parliament the remit and the timescale for a fuller public inquiry, which will look at care homes, but which will look at all aspects of this government's handling of the pandemic. But I want to say to Ruth Davidson, I noticed there was a decision taken in a committee this morning about regulations in Aberdeen. The Conservatives abstained on whether the regulations in Aberdeen should continue or not. And this comes down to every single day just now. Me and this government are having to take a multitude of difficult decisions that have no easy answers one way or the other. We don't have the luxury of abstaining. We are leading the country through a pandemic, and that pandemic is not over. And I say the biggest disservice I would do this country right now, in the teeth of a pandemic that may be accelerating again, as we've seen from the figures in Scotland, is to divert the attention of everybody in government, in our health boards, in our care sector, right now into a public inquiry at a time when they should be focusing on keeping people as safe as possible from the ongoing threat. So I'll continue to discharge my responsibility as First Minister to the best of my ability. And of course, unlike certain other people, I will be held accountable by the electorate for that.
Question number 2, Richard Leonard.
Thank you, Presiding Officer, and can I also thank the First Minister for advance sight of her statement. And I agree with her that COVID-19 is still a major risk, which is why I asked the First Minister if she can tell us how many people who were discharged from hospital to residential care homes in March, April and May had not been tested for COVID-19?
First Minister.
I think twice now in response to Ruth Davidson, I have said we have commissioned Public Health Scotland to work with Health Board to produce the validated statistics on the number of patients tested prior to discharge and the outcome of that test and the date the test happened, and to look at and analyse the rationale for those decisions. We aim to have that data by the end of September. Right throughout this pandemic, we have been gathering and validating and publishing data on a whole range of things that we normally don't have to do. We have to make sure that data is robust, while, of course, we are continuing on a daily basis to take the ongoing decisions that involve keeping people safe. And I would hope that Richard Leonard would welcome the announcement from the Health Secretary earlier this week.
Richard Leonard.
Thank you. But this data, above all other data, is so important because a half of all COVID-19 related deaths have taken place in the setting of our residential care homes. That's why this data is important, and it should be urgently available to Parliament and to the public. A Freedom of Information request by Scottish Labour can reveal today that at least 1,200 people were discharged from hospital to care homes without being tested for COVID-19. And this is likely to be a gross underestimate because 5 of Scotland's health boards, including the 2 biggest, failed to answer. Back on the 6th of May, in this Parliament, in an answer to Neil Findlay, the First Minister stated this, and I quote, "On the situation in care homes, if a patient in a hospital has the virus, they must have 2 negative tests before they can be discharged. Therefore, at every single step of the way, the priority is to prevent infection from getting into care homes. I hope that he will take it in good faith." But now we know, thanks to a Sunday Post investigation, that not only were people transferred into care homes without being tested, they were also transferred into care homes when they had been tested and tested positive to COVID-19. The First Minister asked to be taken in good faith. So can the First Minister simply answer yes or no to the following 2 questions? Were you aware, when you gave that answer to Parliament, that people who had not been tested at all were being discharged into care homes? And were you aware that people who had been tested and had tested positive were being transferred into care homes?
When I gave that answer, I gave the policy position that was the case at the time. That policy position has moved on and developed, but at that point, the policy position was where somebody had been known in hospital to have COVID, they had to have 2 negative tests before being admitted to a care home. That was the position, and that is what was reflected in practice at that time. We've since extended that, so now the testing of patients being discharged from hospital into care homes is wider than that, and of course we now do routine weekly testing of all staff working in care homes. The reason why the position on testing has developed, and this is not unique to Scotland, it is similar in England, although the detail of the policy positions will differ, it is similar in England, it is similar in Wales, it's been similar in other countries, is that our understanding of the efficacy of testing people who do not have symptoms of COVID has changed. It previously was thought that was less effective than it is thought it might be now, and therefore our policy practice has developed. But the other point I've made repeatedly to Richard Leonard, and it's a point that really is worth stressing, that notwithstanding the important role of testing, the fundamentally important aspect of tackling COVID or any other infectious disease in a care home or anywhere else is infection prevention and control, which is why from the earliest iterations of the guidance, the focus was also, as well as clinical screening, was on isolation of residents in their own rooms in care homes, and later on in terms of distancing and restrictions on visiting. So testing is important, but testing has never been and never will be the only way of tackling this virus. And I think it is really important that people understand that.
Richard Leonard.
Well, the First Minister referred earlier on to the Scottish Government clinical guidance from the 13th of March, and it says there quite clearly there are situations where long-term care facilities have expressed concern about the risk of admissions from a hospital setting. But it goes on 3 times in just 5 pages to say that care homes must keep taking transfers. The priority is maximising hospital capacity, and it goes on to talk about flows out of hospital being not hindered and, where appropriate, expedited. So does the First Minister not understand that people who have lost loved ones are upset, but they are also angry? A half of all deaths from COVID-19 have taken place in our care homes. The First Minister talks about transparency and honesty, and she asks in Parliament to be taken in good faith. But out in communities across Scotland, people were being discharged from hospital into residential care homes where the most vulnerable and the most susceptible to this virus are living. It was, as Professor Alison Pollock said at the weekend, like putting a lit match to dry tinder. We know that the Cabinet Secretary for Health has now instructed Public Health Scotland to publish how many people were transferred from hospitals to care homes after testing. But it should not take a national newspaper to reveal through Freedom of Information requests that people who had tested positive with COVID-19 had been sent from hospitals into care homes at the peak of a pandemic to jolt the government into action. First Minister, how was this allowed to happen? Will you accept full responsibility? And will you today apologise to care home staff, to care home residents, and to the grieving families of those who have lost loved ones?
First Minister.
I'd say to Richard Leonard, I'd stand up and take responsibility for every aspect of this government's handling every single day of the week. And I have before, and I will continue to say that if the government has got it wrong at any stage in any aspect of our handling of this, notwithstanding the best intentions we have, yes, I say sorry for that. I am acutely aware on a daily, hourly, almost minute-by-minute basis of the impact of this virus on individuals, on families, on communities, on businesses across the country. And I feel the weight of that responsibility very, very heavily. So the scrutiny and the criticism is all legitimate, but I would ask people not to doubt the seriousness with which I take every single aspect of this. Richard Leonard quotes from the guidance on the 13th of March, which I don't have in front of me, but I'm very familiar with it. The bit he didn't quote, of course, is the requirement to do clinical risk assessments of every patient before they were discharged to a care home, and that is important. The other point is, you know, I regret every death from this, and I regret the situation in care homes, but it was the case, and not just for Scotland, for every part of the UK, for literally every government across the world. At the point these decisions were being taken, the pictures on our nightly news were of hospitals and intensive care departments in parts of Italy not being able to cope because they were so overwhelmed with patients. We were, you know, lots of things have kept me awake at night over the whole of this, but at that point I did not know whether our hospitals would be able to cope with the influx. I also did not know the severe risk that patients, particularly elderly patients who had no need to be there, would be at if they were in hospital while COVID patients were coming in huge numbers. We were dealing with a whole range of difficult decisions that had to be balanced, and we took all of these decisions based on the best knowledge, evidence, and with the best judgment and intentions. We will have got things wrong along the way, and I will forever regret anything we got wrong, but just as we have done, I will continue to do everything I can to lead a government that tries to take the best decisions as we navigate our way through this horrendously difficult situation.
Thank you. Question 3 from Patrick Harvey, who's joining us remotely. Patrick Harvey.
Thank you, Presiding Officer. For schools to remain open, they need to remain safe. And a week on from reopening, it's clear that the concerns expressed by teachers and other school staff, as well as parents and pupils, are still very real. Despite the efforts being made, further action is needed to keep people safe. The EIS have this week made a direct plea to the First Minister, saying 3,500 additional teachers are needed to reduce class sizes. And so far, the Scottish Government is funding less than half of this. They're also asking that guidance on physical distancing and face coverings be strengthened. The evidence is clear that face coverings can reduce the spread of the virus, which is why they're needed in other indoor spaces. And it's just not credible to say that transmission simply won't happen in schools when we know that the risk exists everywhere else when social distancing doesn't happen. So is the First Minister as concerned as I am by the pictures of crowded school corridors and canteens where social distancing clearly isn't possible? And does she believe that face coverings should be worn in high schools where distancing is not possible?
First Minister.
I suppose direct and short answer to Patrick Harvey's central question there, am I concerned? I'm concerned about every aspect of this virus and how it transmits, and we monitor very carefully and try to adapt our response accordingly. I think it's really important that we've got children back to school, because we know the harm that has been done to children from being out of school, away from education, away from their friends, and that is harm to their mental well-being as well as their educational opportunities. So I think it is really important that we have prioritised and continue to prioritise children being back in full-time education. But equally, I understand the concerns that parents have, and they are entirely understandable. We see a number of cases associated with schools right now. There's one in my own constituency that was reported yesterday, St Albert's Primary in Pollokshields, where a class is isolating. And there's a number of these. This will perhaps change, so we can't rule this out, but in the vast bulk of the evidence so far, the transmission is not within the schools. It is community transmission that is causing issues for schools. But we have to keep this evidence under review. The guidance that is in place right now has been informed by scientific evidence. We will ask our scientific advisors to continue to review emerging evidence. There is, I've read summary reports this morning of evidence from the United States about the viral load in children and their ability to transmit the virus. We will ask our advisors to look carefully at that. The Deputy First Minister will chair a meeting of the Education Recovery Group tomorrow, and we will consider the calls that the EIS have made, as well as other calls. I think, to conclude my answer on the issue of face coverings, I do think this is something we have to constantly review, and I'm sure it will be a topic of discussion at the Education Recovery Group tomorrow, and it may well be that is guidance that in the near future we do look to change in terms of the role of face coverings within schools. None of this can be fixed in stone right now. We're trying to navigate a really difficult, uncertain and unpredictable situation, prioritising having children back in school, but absolutely being determined to do anything that is required to make that return to school safe and allow it to continue.
Patrick Harvey.
We do all appreciate that there is uncertainty, but in the context of uncertainty, we should be taking a precautionary approach. And if there's going to be a change on the policy on face coverings, that change should come sooner rather than coming too late. But it's not just education where local services are under pressure as a result of this pandemic. Glasgow Life, which runs leisure facilities, libraries and community centres across the city, expects to lose more than £30 million in income this year because of COVID. And that will put at risk the future of places like Whitehill Pool, Govanhill Library and many others. So far, Glasgow Life have no plans to reopen almost 2/3 their venues. These facilities are a lifeline. The First Minister may even have seen people outside closed libraries in her own constituency. They're turning up there because the Wi-Fi is still switched on and that's their only internet access. So these facilities are really needed. The uncertainty is affecting those communities, as well as almost 1,000 staff who are currently on furlough. Will the First Minister allay people's fears and commit to a bailout for Glasgow Life and similar services across Scotland?
First Minister.
Well, I know the importance of these issues. I don't want to obviously stray into constituency issues, but Govanhill Library, Pollokshields Library too, in my own constituency, that are not yet reopening, which I am concerned about, although I know the difficult situation that the Council and Glasgow Life is navigating. So I see the impact of this on my own constituents, just as all of us see the impact in that way, as well as seeing the impact in our own families and friends. There is no part of life or society that the situation we are living through right now is not impacting on. We want to financially help sectors and individuals and businesses as much as possible, and we look every day at what more we can do. This is not intended to be a political point or moan, but there is a limit to the ability that this government has to make financial resources available. We have limited borrowing powers, and therefore there is a hard limit. We are not able to overspend. There is a hard limit in how much we can make available. We hope that we will see more action, just as we've seen welcome action so far from the UK government, extending the furlough scheme, but also looking at giving more borrowing flexibility to this government and taking decisions that lead to more consequential. So within the resources we have, we will flex that financial resource as much as possible. But I am not doing anybody across Scotland any favours if I am not clear with them that there is that hard limit on what we can do, and therefore encouraging everybody to also think about how we look at changing that situation so that we have greater flexibility. But we will continue to do everything we can, whether it's for Glasgow Live, cultural organisations elsewhere. We're currently, and I think this will come up later on, discussing with the culture sector the disbursement of money that is available to try to help there. We will do everything we can, but we also need more flexibility if we're going to be able to do more.
Question number 4, Willie Rennie.
2 months ago, the Justice Secretary told a committee of this Parliament that 20% of arrivals from abroad required to quarantine were being spot-checked. The actual number was 0. Yesterday, an official government document showed the figure was still only 7%, but the Health Secretary told the Chamber she thought it was 20. Does anyone in the Scottish Government have a grasp of these numbers? Do ministers think it's important to carry out spot checks or not?
First Minister.
Yes, we both have a grasp of the numbers and think it's important to carry out spot checks. I believe some of the information I'm about to give has already been given to Parliament, but if it's not, I stand to be corrected. We committed to Public Health Scotland making contact with around 20% of travellers, up to a maximum of 450 per week, which at that time was considered to be a robust sample size given the number of flights affected. We're currently exceeding that figure with around 600 contacts per week, but as the number of flights increase, the figure of 450, even if it's above that, becomes less than 20%. So we're looking at how we adjust that. In fact, data for last week shows that we contacted just over 1,000 travellers. So we continue as more countries have quarantine restrictions imposed, and there'll be discussions later today and tomorrow with the other UK nations, and it may be that there are other countries added to this list. We will require to take decisions to increase that capacity further. Just to put this in context, we understand that Public Health England take a random sample of 600 individuals from travellers entering England each week. So there is some consistency there in the level of contacts being made by Public Health Scotland and Public Health England. So these figures are there. We will continue to make sure that we are committing the resources to make them proportionate to the level or the numbers of people coming in, and this will be changing as the countries in and out of the quarantine restrictions change as well.
Willie Rennie.
20% spot checks is the government's promise, and after 2 months, they are still not being delivered. And in fact, that document that was published yesterday talked about reducing the numbers, not increasing the numbers. I'm sorry to say that with the Spanish quarantine and the spot check problems, I do have little confidence that the government is on top of this. If the First Minister focused a little bit more on the international border than the English border, we might be in a better position. Three weeks ago, I asked the First Minister if she would test all international students on arrival to keep them safe. She said she was thinking about it. Last week, she said she was still thinking. This morning, the Health Secretary said she was looking at it. But students are arriving right now. How much more thinking and looking time does the First Minister really need? From spot checks to testing, why is the First Minister risking the spread of the virus?
First Minister.
If Willie Rennie wanted to pay some attention to the actual decisions we were taking, he would know that his comment there about borders is completely and utterly ridiculous, and actually I think beneath him. And actually in this, I'm not particularly interested about borders or where they are. I'm interested in keeping Scotland as safe as I can do from an infectious virus, and I'll take whatever decisions are necessary to achieve that. He's also, I think, perhaps not been entirely accurate about what ministers have said. For example, Hamza Yousaf stated that the aim was to contact 20% up to 450 people per week. That is actually being exceeded in terms of it's around 600 contacts a week, and last week was 1,000 travellers. We will increase that as the numbers of countries in quarantine restrictions increases, and that may happen, of course, over the next 24 or 48 hours. And in terms of his second point, my apologies to the Health Secretary, I wasn't able to listen to all of our evidence this morning, but I did happen to catch just in passing the comments she made about universities. She didn't say we were thinking about it. She says we were in active consultation with universities about the finalisation of these proposals. It's important, given the scale of incoming students, given the risks we know that pose, that we get these measures right. And that is what we are seeking to do. And we will continue to look at testing. We will continue to look at the quarantine arrangements that are in place. We'll continue to look at face coverings. And across a range of these different things, we, as the government, as is our responsibility, will continue to take the tough decisions, whatever they may be, while others can simply criticise from elsewhere.
Question number 5, Stuart McMillan.
Thanks, Presiding Officer. To ask the First Minister what discussions the Scottish Government has had with the SFA and the SPFL to allow football clubs to utilise the local COVID-19 testing facilities.
First Minister.
The Government has held a range of meetings with the SFA and the SPFL and the Joint Football Response Group to agree the protocols and testing regimes which allowed SPFL Premiership football in Scotland to resume without putting the public and others at unnecessary risk. To safeguard public sector testing capacity to meet the needs of the public, the testing for Premiership clubs as commercial entities is being undertaken by private sector facilities.
Stuart McMillan.
Thank the First Minister for that reply. And I've been informed that so far over £500,000 has been spent on 7,543 tests by clubs, with this expenditure going to private firms outside of Scotland. And of that, there have only been 3 positive results, which were community-related and not football-related. And many of Scotland's football clubs are smaller community clubs, with NHS Scotland testing facilities in close proximity and not always busy. If Scottish football is willing to pay in full all costs incurred by NHS Scotland for the use of these facilities, can the First Minister indicate whether football clubs will be able to use these testing facilities to take up underutilised capacity, therefore keeping more money in Scotland's economy?
First Minister.
Well, we're certainly aware of the costs associated with the testing of players, and I do recognise that clubs at all levels are facing unprecedented financial pressure because of the pandemic, so I absolutely understand the point that Stuart McMillan is making. But as government, our overriding responsibility is to protect the public sector testing capacity. It may seem at the moment as if that is underutilised. That's because prevalence is low. But as we go into the winter months, when other viruses, colds, flus will be giving people symptoms that may be similar to COVID, we expect that the demand for that testing capacity will increase significantly. So it's really important that we build a capacity that is not just able to cope with the situation right now, but will be able to cope with the situation in the winter. And that is not just about money. It is about the physical capacity of our laboratories and the people that we need with the specialisms to process those tests. So this is not an easy decision, but we will continue to engage with the football authorities to ensure that they have an effective regime in place that can safeguard player staff and the wider population. And of course, we will also have to consider the implications of the resumption of non-contact sport for all ages, and that might have on testing requirements, including for clubs below the Premiership, like Greenock Morton, for example, in the member's own constituency.
Question number 6, Alexander Stewart.
Thank you, Presiding Officer. To ask the First Minister what action the Scottish Government is taking in response to Police Scotland's reported budget overspend during the COVID-19 crisis.
First Minister.
Police Scotland has been at the front and centre of the response to COVID, and I want to thank them for that. They also continue to work closely with local authorities and the NHS to support the wider response. This year, the Scottish Government has increased funding for policing by £60 million to more than £1.2 billion, but we recognise that COVID is an unprecedented situation which will lead to expenditure, or could lead to expenditure above this budget allocation. We will continue to work closely with the Scottish Police Authority and Police Scotland to monitor and manage the financial impacts of COVID on the policing budget.
Alexander Stewart.
I thank the First Minister for that response. The latest quarterly statistics show that there are fewer officers in frontline roles now than when Police Scotland was formed, and the pandemic has strained the public and the police purse by an extra £5 million. Our officers helped keep us and our streets safe at the height of the pandemic. Therefore, it must be right, First Minister, that you back our police officers and give them the funding which they so rightly deserve.
First Minister.
Well, of course, in the most recent budget, which I accept as pre-pandemic, we increased the policing budget by £60 million. The Scottish Conservatives had asked us to increase it by £50 million, so we actually went further than they asked us to do. So I think that is probably a sign of our commitment to policing. And there, of course, are 1,000 more police officers in Police Scotland than was the case before this government first took office. Our police service have done a sterling job in the course of the pandemic. That has increased the financial burdens on them, as has been the case for others in our public sector and more generally. That's why we will continue to work with both Police Scotland and the Police Authority to make sure that we are able to monitor and manage that budget and ensure that Police Scotland can continue to do the fantastic job they are doing on our behalf.
Question number 7, Sarah Boyack.
Thank you, Presiding Officer. To ask the First Minister what support the Scottish Government is providing for the arts sector in light of reported concerns regarding the impact of the lockdown on the sector and the loss of jobs.
First Minister.
Well, COVID is having a profound impact and effect on the arts sector in Scotland, and we want to do everything we can to ensure that our world-class culture can continue to make a vibrant contribution to our country. We acted quickly to support culture with funding for both freelancers and organisations. More recently, we've announced support of £12.5 million for performing arts venues, £4 million for independent museums and £10 million for the events sector. And we continue to work with the sector to ensure the full distribution of the £97 million that we received in consequentials for the arts, culture and heritage sectors.
Sarah Boyack.
The investment so far is welcome. But what work has the Scottish Government done to assess the knock-on impact of cancelled arts events such as concerts and festivals on local economies, in particular the impact on Edinburgh? And will the Scottish Government's support packages include not just institutions but also community arts and those who are self-employed, such as artists and actors, going forward?
First Minister.
I think that is a very fair and legitimate point. Within the financial constraints, obviously, that I've already referred to today, we try to design these financial support schemes and packages in a way that recognises the wider knock-on effects and supply chain impacts. I cannot stand here and say that we will be able to mitigate and ameliorate every single penny of the impact of COVID. I wish I could, but I can't. But we try to do that as much as possible. You know, the support that we made available within the culture sector for freelancers, for example, was an important aspect of that and indication of that understanding of the wider impact. We are still in discussions about the distribution of the full £97 million consequential. Some of that has been allocated already. For example, the Grassroots Music Venue Fund, the Performing Arts Venue Fund, the Museums Resilience and Recovery Fund, almost £4 million to National Trust for Scotland, and the £10 million I've referred to for the events sector. But as we come to decisions on the distribution of the rest of that, I can give Sarah Boyack an assurance that we will keep that wider impact very much in mind.
Thank you. We're going to move on now to supplementary questions. Bob Doris, to be followed by Annie Wells.
Thank you, Presiding Officer. Presiding Officer, constituents of mine have a daughter residing in a Camp Hill residential community supporting adults living with learning disabilities. They are keen to see guidance for visiting arrangements, including returning home for family visits, reviewed, revised and be distinct from that for care homes for the elderly. Such a review will hopefully take account of the lower risk faced by residents in such communities and the very different living environment they stay within. Will the First Minister give this consideration?
First Minister.
Yes, I certainly will. The decision to restrict visiting in care homes was a really tough one, but it was also very important. In June, a plan was published for the gradual return of visiting. We're taking an incremental approach to this because while we've made significant progress, the virus is still a threat. Currently, residents can have outdoor visits with up to 3 people at a time from no more than 2 households, and care homes can move to indoor visiting if they have visiting plans signed off by local directors of public health by the 24th of August. We're also working to reintroduce arrangements to allow residents to go out to visit friends and family. That would need to be staged and risk assessed, obviously, and we will likely prioritise homes for children and people with learning disabilities initially. So we will give consideration to whether further changes to the guidance are needed to address the specific circumstances of residents in communities such as the one Bob Doris has referred to.
Annie Wells, to be followed by Lewis MacDonald.
Thank you, Presiding Officer. A Glasgow constituent has contacted me regarding delays to her surgery to remove precancerous cells from her cervix. This surgery was originally put back in March, but despite calling her consultant every fortnight, there has been no updated timescale for her vital operation. My constituent is petrified about any delay to her surgery and says, and I quote, "To be able to go to a pub before I go for surgery is insulting enough. To be able to go to a pub before even receiving any update about my surgery is quite frankly contemptuous." Now, I know the First Minister will be aware of this case because she was copied into the original email. So can I ask for a firm commitment that she will personally look into this situation to help my constituent get this resolved as soon as possible?
First Minister.
Of course, I will personally look into it. If I was copied into the email, I'm sure that process is underway already. I don't mean in any way to diminish the importance of this, but I hope people will understand I get a very large volume of emails, but they are all dealt with and looked at, so we will make sure that the circumstances there, and if perhaps it would help if Annie Wells was to just email me today the contact details so I can immediately identify the correct case. These are, again, horrendously difficult situations for people to be in. The postponement of certain procedures in the health service in order to deal with the COVID risks was probably, out of a range of difficult decisions, one of the most difficult, and I understand the daily impact of that on people. We now have, of course, in place the national framework for the resumption of cancer services, and that work is underway, but patients, of course, should be being kept up to date, so I will certainly look into that case and see whether there's more we can do to, at the very least, give the individual concerned more information.
Lewis MacDonald, to be followed by Fulton McGregor.
Thank you very much. The Health Secretary told the COVID Committee this morning that the prevalence of COVID in Aberdeen remained too high to lift the local restrictions. This was different from the judgment of the Local Incident Management Committee, which was that the outbreak was adequately under control to allow phasing out from this weekend. Now, of course, advisers advise and ministers decide, and these are not easy decisions, as the First Minister says. But can she tell us today what level of prevalence in the city will allow those local restrictions to be lifted?
First Minister.
I'll try to answer that question as fully as I can, but I want to start by saying I fervently wish these judgments were as simple as that, but they are not. There are a whole range of factors that have to be taken into account. I should say the chair of the Local Incident Management Team participated in the Resilience Committee meeting yesterday morning and indicated that he was in agreement with the precautionary approach that we were taking. Of course, yesterday morning we had double the number of cases reported in Grampian than had been reported the day before. The situation in Aberdeen is that the IMT think that the pub-associated cluster is certainly firmly coming under control and may be under control. The concern, and this was concern expressed very strongly to me and formed the basis of their advice by the Chief Medical Officer and the National Clinical Director, the concern is that there are still a significant number of cases in Grampian and in Aberdeen City that are not evidently associated with the cluster. So there is still a concern of a wider community-based prevalence there. And I gave some figures yesterday just to try to illustrate that. Yesterday, the figure for Aberdeen City of the non-cluster related cases was over 20 per 100,000. And to put that in context, the figure for the whole of Scotland over the last 7 days has been around 6 per 100,000. It is coming down, but again, to give some context, around 20 per 100,000 is when we would probably be imposing, if that was another country, quarantine restrictions. So what we will want to see, and we've undertaken to do a midweek review on Sunday, we will want to see that figure coming down. It is coming down. We want to see it continue to come down. I would like to see it get below 20, but it will be a range of considerations about whether we can reach a conclusion that the situation in Aberdeen overall is sufficiently under control to start to lift restrictions that bring people into contact with each other and, of course, risk transmission increasing again. And I hope that after that review on Sunday, we will be able to set out a firm timetable for the lifting of the various restrictions that are in place.
Fulton McGregor to be followed by Brian Whittle.
Officer, the First Minister is aware of the cluster in Coatbridge, which includes 5 pupils at 2 different secondary schools, and I want to personally thank her for attention to this. I also want to thank NHS Lanarkshire and the Council for their swift response and keeping elected representatives and the public up to date. Can I ask the First Minister what action has been taken to ensure the safety of school pupils where isolated COVID-19 outbreaks like this one have been confirmed? And what else can the Government do to highlight the risks of young people meeting indoors in large groups where there are no regulations such as there would be within schools?
First Minister.
The guidance in place for activity in schools, of course, is informed by scientific advice, but as I indicated to Patrick Harvey earlier on, we're keeping that under close review, and that is particularly in relation to aspects like the use of face coverings. More generally, I think local authorities, health boards, test and protect teams are working extremely well when cases are identified amongst school pupils or adults associated with schools to make sure that steps are taken to inform parents, to advise children where necessary to isolate, and that has happened in all of these cases, and we continue to monitor that very carefully. Most of these cases are community transmission that have an impact on schools. Obviously, we are looking very carefully at any risks of transmission in schools, which cannot be ruled out, but of course we continue to try to take a series of mitigations to keep that risk as low as possible and to respond accordingly. I know parents will be anxious. The schools in the northeast of Glasgow cluster and the linked Coatbridge cluster, where I personally live in Glasgow, is within the catchment area of these schools. So some of my neighbours children go to these schools. I know that this is a time of real anxiety for parents, but that is why getting kids back to school is so important, but making sure the right mitigations are in place to keep that safe is vital, and we take that responsibility very seriously.
Brian Whittle to be followed by Polly McNeill.
Thank you, Presiding Officer. I know the First Minister is aware of the importance of being physically active, both physical and mental health, and government guidance suggesting that, or says that under 18s are able to play sport in an outdoor area, yet so many public facilities still remain closed. What can the First Minister do to make sure that there is facilities available for those under 18s to play the sports they so wish to do?
First Minister.
Well, I hope some of what we've announced today in terms of the opening up of indoor sports facilities, as well as extending outdoor, the ability to do sports outdoors will help with that. All of this is a balance and a journey, and I absolutely understand, which is why we've taken the decision we have today to slightly accelerate the ability to reopen of gyms and indoor sports courts and swimming pools, for example. The importance of physical and mental health of exercise is understood, but we've got to balance that against the proper arrangements in place to minimise risk of transmission. But I think the further steps we've set out today, I think, take us very firmly in the right direction.
Polly McNeill to be followed by Kenneth Gibson.
This week, 42 job losses between Glasgow City College and Clyde College were announced due to a drop in footfall due to COVID-19, where the college agreed with the contractor to replace the catering service with vending machines. This is a mainly group of women workers who are in very basic poor redundancy packages due to being run in the private sector. How does this First Minister square with the Education Minister's letters to college principals that they should look to maintain jobs? And I wonder if the First Minister would agree with me that it's short-sighted of the college to replace an entire catering service with vending machines, because I think everyone would like to think that in the long run we'll go back to some kind of normality. Can the First Minister look at this, take what steps that she can to prevent outsourcing in the future, because at least if it wasn't outsourced, they would have better terms in the public sector? Can she do anything at this stage to intervene and save the jobs for these women?
First Minister.
I'm very happy to look at it. I'm not aware of all of the details, and I'll ask the Education Secretary to look at it as well. I absolutely appreciate the points Polly McNeill is making, and I have a lot of sympathy with those points. Of course, colleges have to take these decisions independently, but I will look into this. So I don't want to sort of prejudice that. But generally speaking, right now, everybody's having to make really difficult decisions, trying to reduce transmission risks while getting people back to normal. So it is easy, I think, to accuse people, and sometimes it may be justified, of being short-sighted. Sometimes this is just really unenviable decisions that everybody's having to make to get that balance as right as possible. But given that I don't know all the details of this, I will happily have it looked into, and either myself or the Deputy First Minister will write to Polly McNeill when we've had a chance to do so.
Kenneth Gibson, to be followed by Liam MacArthur.
Thank you, Presiding Officer. First Minister, the 19.7% decline in Scotland's GDP from April to June is deeply worrying. Does she agree with Scottish Chambers of Commerce that further intervention is required now to prevent real and lasting damage to employment levels? Scottish ministers have outlined clearly what this government will do, yet its most economic powers remain at Westminster. So will the Scottish Government continue pressing the Chancellor to extend furlough, immediately reduce employers' national insurance contributions, extend the cut in VAT in vulnerable sectors to next summer, and back new initiatives such as an employee retention incentive scheme to enable struggling employers to survive until the economy recovers?
First Minister.
The economic crisis that we're facing right now is severe and is the most acute of any of our lifetimes, and we all have a responsibility to do everything we possibly can to protect jobs in the short term, but then support the economy to a longer term sustainable recovery. And the Scottish Government is very focused on doing that. You know, I've said a number of times, but for the foreseeable future, health and jobs are the twin priorities and the twin focus of this government. We will do everything we can within our own resources to facilitate that, but it is the case that many of these levers do lie with the UK Government. So we need to continue to make the case both for increased spending in a number of areas to support economic recovery, but also, and I think most urgently, to make the case and press the case with the UK Government for the extension of the furlough scheme. I think one of the most wrong-headed decisions that may be about to be made is to end that scheme prematurely. I think that could see an avalanche of redundancies that are avoidable if support continues. And I noticed earlier this week Germany became the latest country to extend their equivalent scheme for a longer period, I think in Germany for up to 2 years. So I would appeal to the Chancellor, who has given lots of very welcome support here, not to make the mistake of ending this scheme prematurely and to continue it for as long as is required.
Liam MacArthur, to be followed by Keith Brown.
Thank you, Presiding Officer. To qualify as a paramedic, you now need to complete a degree course. During this course, students are expected to work the same hours as a fully qualified paramedic, making part-time working almost impossible. Student nurses in Scotland are given a bursary in recognition of this. Paramedic students in England also receive a bursary. When I wrote to the Health Secretary recently on behalf of a constituent to ask how my constituent is expected to fund herself through the degree course, I was told the Government has no intention of reviewing its position. Why won't the Scottish Government support trainee paramedics properly? And will the First Minister agree to put paramedics on a par with student nurses and midwives?
First Minister.
I think this is an important issue. I've also been contacted by a constituent in the last little while about this, and I think the case that is made is not, absolutely not without merit. I've seen a response from the Health Secretary on this, which sets out the range of support that is available for trainee paramedics. Obviously, we've taken, unlike other governments, some other governments in the UK, a decision around continuation of bursaries for student nurses and midwives, which I think is important. Look, none of these dilemmas have easy solutions within the financial constraints we operate within, but I hear the case that has been made, and we will continue to consider how we better support, whether it's paramedic students or anyone else working in our health service. And I'm happy to have a further look at that with the Health Secretary and revert to Liam MacArthur when we've had the chance to do so.
Keith Brown, to be followed by Liam Kerr.
The First Minister has often spoken about the impact on her political beliefs of the mass unemployment from the 1980s. And I know that she's well aware of the scarring effect of unemployment on young people in particular. Can she say what action the Scottish Government will take to support young people back into work?
First Minister.
Well, aside from the immediate challenges of tackling COVID, this is, I think, the biggest responsibility that governments the world over have right now, is to stop the impact of this becoming a scarring legacy for the next generation. This is a really uncertain time for young people. We've committed to investing £60 million in this financial year in a youth guarantee as part of the overall investment for employment and skills we announced last month. And that is one of the first actions taken forward from the Advisory Group and Economic Recovery report, and sets out very clearly the employer-led plan to give every young person access to work, training or education. We've also recently announced that this will include £10 million on measures to support and retain apprentices. And just on Monday this week, our 8th Scottish benefit was introduced. That was the new Job Start payment, which will provide a one-off grant to young people between the ages of 16 and 24 who've had a period of unemployment, and it can be used to cover the cost of a new job like travel, clothes or childcare, to remove barriers that young people can face and support them into work. So these are some of the immediate things that we're doing, but this responsibility to make sure that all young people have the opportunities that they deserve, notwithstanding COVID, is one that is going to be with us and on us for a considerable period of time.
Liam Kerr, to be followed by Jackie Bailey.
Officer, the public health measures to suppress coronavirus must be matched with the right support so my Aberdeen constituents can continue to provide for themselves and for their families. Businesses are on a knife edge. Aberdeen Council are clear that over 5,000 jobs are at risk without more financial support. First Minister, the North East must not be left behind. Will you listen to the North East and pledge urgently further funding support?
First Minister.
Every part of the country deserves support to help it through what we are living with right now, and that absolutely includes Aberdeen. In fact, it's particularly the case for Aberdeen given the current restrictions. The 5,000 jobs number that has been used, which is a very serious number, and I'm not intending to underplay it at all, but I've heard I think Liam Kerr talk about that as if that is the impact of the current lockdown measures in Aberdeen. That is not the case. These figures relate from April to July, which doesn't make them not serious, but I think it's an important clarification. Look, we have obviously already made available to businesses in Aberdeen £32 million of grant support. So the additional funding that was announced yesterday is in addition to that. I would really love to do more in terms of economic support for Aberdeen and for other businesses in other parts of the country. But I come back to this inescapable point that the budget my government has limits to it because of the limitations in our ability to borrow and our inability to overspend and borrow to meet that. So that, I'm afraid, is a hard fact, and I hope that those who rightly are calling for more money to be made available to Aberdeen or to other parts of the country will join with us in making that case to the UK government to increase our borrowing powers or make more funding available, because without one or other of those or both of those, we are going to run up against these very hard limits in what we can do. And as I say, that is not, in this context, a political point. That is a statement of fact, and it is a fact of life. So I would appeal to the Conservatives, by all means, make the case for more money, but join us in actually calling for the wherewithal to deliver that extra investment.
Jackie Bailey, to be followed by John Mason.
In January 2019, the First Minister said in this chamber that she would cooperate fully with the parliamentary inquiry into the government's handling of sexual harassment cases. And I quote, "The inquiry will be able to request whatever material they want, and I undertake today that we will provide whatever material they request. My commitment is that the government and I will cooperate fully with it." Given that swathes of documents are heavily redacted and the Scottish Government is refusing access to key documents relating to the core of the inquiry's remit, I hope the First Minister will want to stand by her earlier commitment, and will she now instruct the full cooperation that is currently missing from the Scottish Government?
First Minister.
Well, this is a really serious issue. I am absolutely committed to fully complying with the inquiry. I will personally attend the committee to answer questions when I am asked to do so. I have already submitted written evidence to the committee. It's obviously for the committee to decide when and to what extent that is published. I have also, given that part of the committee remit is to look at my conduct, I have recused myself from any decision-making in terms of the government's interaction with the committee. So I am not going to instruct the government, because it would not be appropriate for me to do so, given and the government will continue to fully cooperate, I am sure, and within the legal obligations that the government operates under, make available the maximum amount of information that it can to the committee. I am absolutely committed to abiding by this committee's processes. You know, sometimes I wonder if everybody is that committed. The other day, a Conservative member of the committee issued a political press release about the evidence taking of the committee, suggesting that they are not prepared to abide by the processes of the committee and perhaps have made their minds up about its outcome before they even get there. So I will respect the committee. I will fully cooperate with the committee. I hope others across the chamber do so as well.
John Mason, to be followed by Murdo Fraser.
Thank you, Presiding Officer. We have seen elections recently in Belarus, which the results appear to have been rigged, with the opposition getting a mere 10% and the candidate having to leave the country. Does the First Minister share my concerns about this, and is she able to pass on these concerns either directly to Belarus or through the UK or through the European Union?
First Minister.
Yes, I do very much share John Mason's concerns, and like the views that the UK Government and other governments across the world have already made known, I think it is important that the results of that election are not recognised because of all the concerns about their lack of legitimacy and validity. And I'm very happy to make those concerns known either directly or indeed through the Foreign Office, which, as I say, has already expressed similar views.
Murdo Fraser, to be followed by Colin Smith.
Thank you, Presiding Officer. Further to Jackie Bailey's question a few moments ago about the handling of harassment complaints by the Scottish Government, the First Minister did indeed pledge back in January 2019 that all parts of the Scottish Government would fully cooperate with a parliamentary inquiry. On Tuesday, at the meeting of the Parliamentary Committee, I asked the Permanent Secretary, Leslie Evans, if she was aware that female civil servants had been advised not to be alone in the company of the former First Minister. She answered my question and said that she could not comment. Does the First Minister believe that that response was in accordance with her commitment that there would be full cooperation from all parts of the Scottish Government? And was the First Minister herself aware of female civil servants being given that advice?
First Minister.
No, I wasn't. I will answer all questions that are put to me by the committee when the committee asks me to do so, unless, of course, they are asking me questions that my answers would breach legal requirements, but I will answer all questions. I am not going to comment, because it would not be appropriate, on the evidence other people give, because I think it's important that I respect the committee in all aspects. As I understand it, and this is entirely for the committee, that question was ruled out of order at the meeting. But I also understand, but this is something that the committee is perfectly entitled itself to take up, I understand that the Permanent Secretary has already said that she is happy to write to the committee to address this issue if the committee wishes. So, you know, I will cooperate fully with this. I come back to the point I made earlier on. I have already submitted myself evidence to this committee. I am respecting the fact that it is for the committee to decide when that is published, because they have important and sensitive legal processes to undergo around that. I am respecting every aspect of this committee's work. Murdo Fraser is, as I understand it, already or about to be a formal member of this committee, and within hours of it having its first evidence session, he issued a political press release accusing me of not being forthcoming and giving the impression that he's anything other than independent and neutral. And I think he should perhaps consider that himself before he asks me, who intends fully to respect every aspect of this committee's work.
And Colin Smith.
Thank you, President Officer. Commuter rail fares have risen by 54% under the SNP government. It was confirmed this week that unless we have a change of policy from ministers, those fares will rise by another 1.6%. Does the First Minister agree with me this is not the time for more fare hikes, that we need at least a ticket price freeze and a new fares regime that is affordable and ultimately will encourage people back onto our rail network as it becomes safer to do so?
First Minister.
Well, we haven't taken a decision yet on rail fare increases. We are considering that in the context of COVID and the significant disruption to rail travel. So we'll take all of these issues and points into account as we come to a final conclusion.
Thank you very much. And I'm going to draw First Minister's questions to a conclusion there. Apologies to all the members who didn't get a chance to ask a question.